We're now going to go over some newborn care instructions for when you take the baby home. It's important when you're leaving the hospital to have a car seat present, especially if you're planning on going home in a privately owned car. It is the law that if you're taking the baby home in a car, the baby must be in a car seat. It is not the law that the baby has to be in a car seat in a taxi cab. However, it is much safer to take the baby home in a car seat, so we do highly recommend it. The car seat should be intended for newborns. It should be an updated recent car seat that is considered safe under the present laws, and you should know how to use it, so please read over the instruction manual prior to getting to the hospital. Review how to tighten the straps and make it looser or tighter for the baby depending on how big the baby is, so that we can securely place the baby into the car seat. The nurse can look at the car seat prior to you leaving the hospital just to ensure the baby's in there safely, but we are not permitted to put the baby into the car seat for you. The chest guard does go at the chest. It shouldn't be too high or too low on the baby. It shouldn't be near their neck at all. It should go against the chest. The car seat should be snug enough that I should be able to put my hand between the guard and the baby, but I shouldn't be able to wiggle my hand. The baby should not be swaddled underneath the straps. Any blankets need to go over the straps once the baby is securely placed in, so the arms and legs can go through the straps as needed to make sure the baby's nice and secure. If you're not going home in a car, you are allowed to go home with the baby in a stroller or in a carrier if you're going to be walking. Prior to leaving the hospital, the baby will have a newborn hearing test. We'll give you the results of this test before you leave. Hopefully the baby will pass. If the baby does not pass, do not get alarmed. Sometimes the babies gather fluid in their ears from being in utero for 9 months, and it's just not drained out yet, and so they may not pass initially. We'll give you an appointment here at the hospital to follow up with a hearing specialist in a few weeks after discharge if the baby does not pass here in the hospital. Some pediatricians do the test in office, so if you're following up outside after discharge with a pediatrician that does the test in their office, once the baby passes or you get the results from the test, it is mandatory that you fax them to the number we give to you at discharge. If we don't receive those results and you don't show up to your follow-up hearing appointment here, we will have to contact you and your pediatrician. So please ensure that you do fax those results to us if the baby passes at an outside office other than our own here at the hospital. Depending on when the baby is discharged, the baby should follow up with a pediatrician 1 to 3 days following discharge. If you leave the hospital at the 24-hour mark, the baby will need to be seen the day after you leave, so just 1 day, and that is mandatory for most of the pediatricians to discharge the baby. So please make sure that prior to leaving you have that appointment. If you're leaving the hospital after a 2-day stay, the baby can follow up in 1 to 3 days depending on how your pediatrician directs you the pediatrician here directs you when you leave the hospital. It is important that after discharge you call the pediatrician if the baby is extremely lethargic. Babies sleep, but they do wake up when they're hungry. They wake up when they have dirty diapers that you're changing. But if the baby sleeps so much that the baby misses one feeding and then is at risk for missing a second feeding, you call the doctor and let them know. The baby missing one feeding here or there is acceptable, but once the baby misses 2 feedings and it's really very difficult to wake the baby up, you want to make sure to call the pediatrician and make them aware. If the baby is extremely irritable and you have tried everything you can think of and nothing is working to calm the baby down, and you've tried rocking and soothing and the baby isn't hungry and the baby doesn't need to be changed and nothing you can think of is working and it's been a couple of hours or several hours, you want to make sure to call the pediatrician and make them aware. If the baby has any projectile vomiting, you want to make sure to notify the pediatricians. If the baby spits up, whether it's projectile or not, or vomits anything green, you want to make sure the doctor is aware. We do not like the baby spitting up or vomiting anything green. You also want to call the pediatrician if the baby has any watery stools. Newborn stools can be looser, but they should not be watery or diarrhea-like. So if the baby has extremely watery stools, you want to notify the pediatrician immediately after discharge. If the babies should go to the bathroom differently for breastfeeding and formula feeding. Formula has a little bit of iron in it, so they might not stool quite as much as if you were breastfeeding. So if you suddenly start formula supplementing at home and notice a change in the amount of stools, that's acceptable. However, if the baby goes 3 to 4 days without any stool at all, you need to notify the pediatricians and make them aware. In your You and Your Baby Health Guide on page 13, we have a breastfeeding diary. It goes by days. Remember, the day you deliver is day 0. Day 1 is the following day. And the chart starts at midnight of that day. And you can tally up your feedings, wet and dirty diapers. There are some color changes that should occur in the diapers if the baby's feeding appropriately. And there are also the expectations of how many times a day the baby should be eating, peeing, and pooing. This diary goes up to day 8. It's very important to keep track of the stools and the urines because we can't see how much milk is coming out of your breast. And so to know that enough is going into the baby, we need to make sure that enough is coming out of the baby. That is how we keep track. It's also important to keep track even if you are using formula also or only formula, because we do need to make sure the baby's eating enough. So we need to keep track of pees and poos always. They will be very important for your pediatrician to be notified of. When you leave the hospital, you will leave the hospital with a newborn health record. It's a yellow card that will have the birth information of the baby, an immunization chart, a growth and development chart, an area for you to keep track of healthcare visits and screenings. We will do all of the we will place on here all of the screenings that we do here in the hospital so that your pediatrician will have record of them. They will mainly include the hearing testing, the PKU screening, which is a genetic and metabolic test done on every baby born in New York State. You can ask your nurse for a pamphlet on the test and she can give that to you. And we will mark that on here. We will also give you the lab slip for the test that we do. This blood goes to the state. No news is good news. If no one ever contacts you after, there's no need for concern. You can look the results up with the lab ID number at the web page on the slip that we give to you, and your pediatrician will need this number also. We'll also mark down a congenital cardiac heart disease test that we'll do on the baby. What we'll do is just make sure that the baby is oxygenating all limbs appropriately and equally prior to leaving the hospital, and that's just a screening we do for any congenital cardiac issues. We'll also document the baby's discharge weight so your pediatrician will be aware of what the weight was when you left the hospital. It's normal for newborns to lose up to 10% of their birth weight in the first week or so of life. As long as they don't lose more than 10%, it's okay. You will have to notify your pediatrician. Your pediatrician will have to keep track of the weights to make sure the baby does not lose more than 10%. So we will put the discharge weight here. We'll also put a bilirubin for the baby prior to you leaving the hospital, and we'll document that on your card. Bilirubin is the substance that our bodies produce that we excrete in urine and stool. All of us have it. In babies, it can sometimes not be excreted so well by the liver, and just because they're new at everything and they're not working at full force yet. And the bilirubin can build up in their system if not excreted so well. And that makes them yellow. So that's called jaundice. So we do a jaundice screening on every baby prior to leaving. And again, we will document the bilirubin for your pediatrician on the card. The jaundice signs of symptoms or jaundice are a yellowing of the skin that starts on the face and can work its way down to the nipple line. What you would do at home if you started to see any increasing jaundice or yellowing of the skin is immediately notify your pediatrician. Start feeding the baby more, because the more they eat, the more they pee and poo, and what makes them yellow, again, leaves their body in their stool and their urine. And expose the baby to some sunlight. So unwrap the baby and hold the baby and do some skin to skin so that the baby stays warm, and let the sunlight, sit near a window and let the sunlight hit the baby's skin. The sunlight helps them to process the bilirubin just a little bit faster. For safe sleeping practices, it's the ABCs of safe sleeping. So the baby should be alone, on their back, in the crib. It's very dangerous to co-sleep with your baby. While it's okay to have some cuddle time, you really don't want to fall asleep with the baby in the bed with you. It can be extremely dangerous and very easy to roll over onto the baby or have the baby fall out of the bed. So the baby should be alone in a crib or bassinet when sleeping. The baby needs to sleep on his or her back. There is no stomach or side sleeping for the baby. It's very dangerous and can cause an increase in sudden infant death syndrome. So the baby should be alone on their back in a crib. We don't put any hats on the baby for sleeping, and again, it's best to be in just a onesie and one outfit instead of multiple different articles of clothing. There should be no bumpers or toys in the crib with the baby also. It should be an area free and clear. There should be no extra blankets in the crib with the baby either. It's considered very dangerous. As far as dressing the baby is comfortable in one added layer to whatever you're wearing. So if you have on a shirt and longer pants, the baby should be covered with longer sleeves and longer pants, and then one additional layer over, which can be the swaddle blanket. While you're here in the hospital, the nurse will offer you the hepatitis B vaccine to be done for the baby. This is a series of 3 shots, and you can begin the first one here in the hospital. There's information on page 27 in your newborn health guide. You can also speak to your pediatrician that you'll be using outside the hospital as to whether or not they want you to do this here, but it is your choice whether or not it's going to be done here or at the first pediatrician visit. It is recommended to do it as soon as possible. So you can also discuss with your nurse whether or not you would like to do that here in the hospital. We do recommend that mom gets the Tdap vaccine if she hasn't already done so during the pregnancy, and the information on that vaccine is on page 29. Anyone that's going to be around the baby on a regular basis should have a recent Tdap vaccine within the last 5 years, and mom should have it either during the 3rd trimester or immediately following delivery. If dad has not yet received his Tdap vaccine, or if grandma or grandpa would like to get the Tdap vaccine, there is a doctor's office nearby the hospital that offers it, and that's on page 31. And you can call to schedule an appointment while you're here if needed. And that's all.